Namaste, good morning viewers. Today we're going to have a very special video on how to manage issues around the eye. So we've divided that into two. We're talking about the orbit, which is a bony eye, and the soft tissues around the eye. So we have with us two of our eminent team members. Dr. Priya, her basic training is ophthalmologist, and then she's done a specialty training in oculoplasty. And then we have my good friend Ananth. He's basically maxillofacial, and then he's done his training in orbital management, especially the trauma, secondary reconstruction, and all aspects to the bony orbit. So today we're going to get through some of the basic points, and I keep mentioning this in my earlier videos, that teamwork is key. And I do say that each and every member of our team, if not as good as me, is only better than I am. So you can really trust in the work that we will do on patients. We've lined up a few questions. I also want to clarify some of the issues, and we will ask the doctors here about their expert opinion on these aspects. So first up, we're going to ask some questions to Dr. Priya about the soft tissue aspects of the eye and how we're going to manage it. But before that, let me tell you that the orbital issues that we're going to discuss in this video is all secondary, meaning it's not something that comes immediately out of an accident, but the issues that stay behind after an incident or an accident. And we've also classified them into two. We have the functional issues and we have the cosmetic concerns. The two main functional issues that we're going to address today: diplopia and epiphoria. Diplopia is double vision, epiphoria is when you have excessive tearing. So these are the functional aspects that we'll be addressing. The cosmetic issue is with regards to the eyelids, how inability to close it properly, or overclosure, or just to get those eyes look fresher. Procedures to do all of these. Alright, so first, Dr. Priya, can you tell our audience about what are the mainstays of managing soft tissues around the eye, especially the eyelids?
Okay, eye is the most appealing part in the face. To make your look fresh, there are a lot of conditions like dark circle and baggy eyes will make you feel bad. So blepharoplasty is one of the main treatment to look you fresh, to clear the dark circle and also the baggy eyes. Here we are doing lot of blepharoplasty, cosmetic purpose. So this is the
picture.
You
have a before and after here. So you can see how the eyes are looking tired, it's swollen. Yeah. It's a combination of fat removal and skin removal and tightening of the entire region that's done, and in a very scarless approach. As you can see, you don't see any scars. This is a month after the procedure is done. Alright, we're going to show you another picture quickly. Do you have that one? Yeah, so this is very subtle work, very fine work. But again, you can see she has issues under the right eyelid, lower eyelid, and that has been taken care of there.
Actually, twice she did surgery.
Oh, this was, yeah, so this was a redo also.
Also, yeah.
So we can also take care of your eyelids, even if you've got them done elsewhere and you want more improvement, we should be able to sort that out for you. Alright, now we move on to Dr. Ananth. I'm going to ask him some questions about the bony part of the orbit. So Ananth, why don't you explain our audience about the understanding of the orbit in terms of the bony covering and how this relates to the shape in the eyes, how this also translates to functional problems that can be addressed.
Okay.
You want to use your
Thank you, Sunil. So first of all, let's understand what the orbit means. We all know that it is the bony framework around the eye, and it has numerous amounts of number of bones which add to it. Okay, there's a lot of bones which interdigitate in forming this nice little compact system into which the eyeball is placed. So essentially, when you look at problems related to the eye because of the bony orbit, like what Dr. Sunil has already explained, you have functional problems as well as cosmetic problems. So when you look at function, the primary function of the eye is vision. So you can have visual disturbances, but most of the visual disturbances are not related to the bone work, but it can cause subtle changes in the form you see figures. For example, the most common problem that we face is or come across is double vision, which means when you focus on an object, we are expected to see it as a single object from both the eyes. But these people do not see it as a single object, they always see it as two figures, and they can be placed at varying distances from each other. This can happen because of physical impediments which are happening within the orbital framework. It can be because of bony problems as well as muscles which control the movement of the eye. So that is pretty much the functional aspect. When you look at cosmetic aspect, remember that you have the eyeball which is placed, and the eyeballs need to be symmetric. So on both the sides they need to be symmetric looking. So when you have changes in the position of the eyeball, like one is placed forward or backward, or one is placed upward or lower than the other one, that also leads to significant concerns, both functionally sometimes as well as cosmetically.
Thanks so much for the useful explanation. So this is a scan that is one of Ananth's patient that you can see here. So this is where the trapdoor is there, the orbital shape you can see is become bigger. So it's like if the orbit becomes bigger, then the eye goes inside and you tend to have ophthalmosis, which is mostly a cosmetic concern. And then this is after it has been addressed. I hope you can see that how there's a nice mesh sitting up to get the defect covered. Alright, so we're going to move on now. The next question is, so how does or how can we incorporate both this bony work and soft tissue work? I want you to start.
Yeah, we can combine both bony work and soft tissue work. While correcting the bony work, while doing itself, we can correct soft tissue also. We cannot go
so
for separate, benefits for patient.
So the patient can correct the problems with the eyelid. They can also get the problems with the position
Why to
of the
go
globe.
for 2 surgeries,
Exactly.
2 times trauma?
So that's a big thing. Like we say, we take care of the face as a whole, and now we can also take care of the eyes as a whole, because it's a component. At each of this area, there are specialized surgeons today, and so when you get a few of them together, then you can get all of that done in the best possible way at one go. All right. I also have some questions about recovery time. So you would want to tell us about what's the normal recovery time patients can expect if they just get for a soft tissue procedure, and also how many of them can we do under, let's say, daycare or local anesthesia?
Yeah, most of the blepharoplasty surgery patient prefer daycare procedure because that is more convenient for them. They can go to work very earlier. So minimum 2 weeks complete rest.
Maximum downtime is 2 weeks.
2 weeks.
Minimum is 2 days, I think. Alright, so that's with the lower eyelid and the upper eyelid procedure with blepharoplasties. So as you heard, it's a daycare procedure. Ananth, what about the major orbital work that we're talking about? What do you think is the recovery period? And how long would we advise our patients to come over and spend time with us and then also take leave?
That's right. So when you're looking at recovery period, what we need to see is the gravity of the injury. Sometimes there are small defects, like what the scan showed. You can have a single wall defect or a double wall defect. The wall means whatever is the internal bone of the orbit. Sometimes what happens, the rims also get fractured, and along with other facial bones. Then we are looking at a major procedure. Now when we are looking at simpler procedures, the downtime is very, very short. In fact, you can be back to work between 5 and 7 days. While if it's a slightly major procedure, then we are looking at around 10 to 12 days time. Most of these procedures, the simpler ones, are performed as daycare procedures, while the more complex ones, where we feel that the vision needs to be monitored over a period of time, at least for about 12 to 24 hours, then we have an admission time of about 24 to 36 hours.
Alright, thanks. Now we want you to have a look at these pictures. Can you just tell them?
Yeah, this is a very nice patient, and I think there are 2 questions we can address because of this. One thing is you can have a look at the position of the globe, which is the eyeball.
This eyeball is not at that level.
That's right.
Why the straight line is there.
So there is a vertical difference. You can see that one has come down.
Pre-operative. That is before surgery. The way the patient got here with us to us.
So the left upper figure is able to show you that the right eyeball is actually down, while the left lower one is showing that it is also behind. So these are the different changes in position that you can have. Another thing to add with this is the post-op corrections has been done very adequately to replace the eyeball in the right position. But like what Dr. Sunil said, you can actually have a look at the eyelid on the right side, which is actually showing a small gap. That's called a tear trough. Okay, so that can also be addressed if a good team falls in place, and it can be done as a single procedure. Now these are the kind of procedures that you can handle as a simultaneous procedure, while certain procedures where the eyelids need to be corrected have to be addressed only after the final position of the eyeball has been in place. For example, if you have an eyelid that is not closing, or an eyelid which is actually remaining closed and it's not able to open, then we need to understand what is the final position of the eyeball before we set the eyelid at the final position. Then we may need two procedures.
And this is another case where you can see that improvement much more clearly. You can have a look at that eye, this was stiffer, and you can see that improvement for yourself. And that's another view, wherein this eye literally is gone so deep, gone so inside, it's really become very inset, the eyes become very small. So if you have a case wherein the eyes become smaller, the eyes descended down, or the eyes gone behind, or basically it's not the same as it used to be like the other eye. And all of those issues can be taken care of. One of the very common questions we keep getting asked, especially on YouTube and Instagram, is that will my vision get affected? Now I have to tell you very clearly, the vision will not be affected. Whatever vision you have will remain the same. Whatever procedures we do here, I know it's scary when you think that we're going to work around the eyes, work around the bones of the eyes and everything. So many of the patients are like, Dr. Saab, my vision should not get affected. And I keep telling this to them, that vision will not be affected. These are very safe, predictable procedures, wherein only these kind of changes will be achieved. Nothing will happen to your vision the way it is, it will remain same. We do not do any procedures to improve your vision. At the same time, none of the procedures that we do will worsen your vision as well. So this is something you have to keep in mind. And these are the kind of changes that you can expect with regards to work around the orbit. Last question, a lot of patients also come to us with injury on the forehead, which also affects the eyes, and we haven't got a similar picture here right now. So what is the connection between an injury on the forehead and a corresponding or a change in the shape of the eye?
Okay, now we all know that the eye socket has a roof also. For example, it has a roof, and the roof is intimately connected or a part of the forehead. So when you have injuries to the forehead, for example, we have a model here where you have an injury to the forehead. What's going to happen is the roof is going to descend down, or it's going to be shattered. And remember that the eye is controlled by a number of muscles, and one of the important muscles that happens to run along the roof is the superior rectus, which means it's going to help taking the eyeball up, as well as trying to act as a opposing muscle to the one which takes it down. So if you have any fibrosis or adhesion, or the muscle gets stuck, then the function of the eyeball is going to get hampered. At the same time, there is going to be a lot of cosmetic deformity in this area, because it's a significant part of your facial feature, which is forming the eyebrow. So that also has a significant cosmetic role when it comes to frontal bone fractures as well as the roof.
Alright, so Madhu, can you just tell our audience about what was done for this patient in terms of the preparation?
So first, when a patient comes to us, we tend to send them for a CT scan. We order a DICOM format, and then we get the DICOM from the patient and send it to the lab to form skull models like these. Therefore, it allows us to plan in order to what form of reconstruction they will be needing, and what the results they can expect. So it's easier for the patients to comprehend with the treatment plan, and for us to make our surgery easier, we can perform this on a skull model. So that is called as a mock surgery, which we also do in orbital reconstruction.
And most importantly, if in case like a patient like this, one eye is injured and the other eye, the orbit is normal, so we mirror the normal image onto the injured side, so we get that exact symmetry. So these models help us to achieve that perfection. Do remember, these are procedures wherein a millimeters matter. In fact, most of the surgeries are for millimeters, and to get that precision, these models and various gadgets do help. And now the last question, before we wind up, is there any role between age and these procedures? None?
No.
But she's mainly handling the soft issues, and I think so most of the patients are elderly. You wouldn't want to do any work on the eyelid. There are issues when kids are born with craniofacial problems, and we do a lot of work on the eyelids. So essentially, there is no age bar. So even if you are 3 years or 85 years, age is not a thing that says, oh, we cannot do this if you're 85 or we cannot do this if you're very young. This is a young girl where we've taken care of the eyes as well, apart from the rest of the face as well. So age is not a problem. Ananth, do you want to say something about the issues kids have? We haven't got a scan here, but what if a child who's 5 or 6 years has an orbital injury, the bony structure? Is it any different from managing an adult, or would you want to do something differently?
Okay. So, like what Dr. Sunil has already said, you can have two types of problems which are associated with children. One is what we call as congenital or birth defects, like what is already being portrayed there, where the problems can manifest the orbital walls and the eye can have secondary changes. The other one is what happens to a child when the child sustains an injury. So remember that the child is a growing person, and there are definitely growth manifestations when the child gets injured. Let's all understand one thing: the eyeball does not grow much. So after about 1 or 2 years, 85% of the eyeball growth is complete. But remember that the bones around the eyeball actually grow. So when you have an injury to a child, even though we do an orbital reconstruction, at certain points of time, the bony framework may need to be revised after the child attains a certain degree of growth, especially between 11 and maybe 17 or 18 years. You might have to do a revision procedure because the facial skeleton sometimes grows or rather is expected to grow while it does not grow as a result of the injury. So that's the pretty much
So the
picture.
take-home point is very clear. Even if there's an orbital injury for younger individuals, you're a kid of 3 years, you have to get it done immediately. Even though you might need a procedure, or the patient might need a procedure as the patient grows up and becomes an adult. There are a lot of patients asking us questions. Doctor, my kid is 4 years old, so they've asked us to wait for 10 more years, or they asked us to wait for till she becomes 15. No. So that's the point that he's brought out so clearly. You have to address that at that point in time to at least reduce the growth issues the child might have growing up. But that doesn't mean that the child may not need a procedure later on. But still, as far as the treatment is concerned, it's mandatory that you could get at that time, and age is not a factor. This is another patient. You can see the issue was a fold. Yeah. You want to explain?
She don't want that fold which is in the upper lid. She is very particular in that. So we did blepharoplasty, upper lid blepharoplasty to remove the fold. So this is the after. So
this is before. This is what you see. She has a fold in the upper eyelid.
She doesn't want that fold. So this is after surgery. See the upper lid.
Scarless procedures. Can you tell them something about how we can do a lot of procedures on the eye without any scars?
Yeah, mostly for blepharoplasty we can do conjunctival approach.
Yeah.
So we can
is from inside the eye. You can't see anything. Okay.
Yeah. So this is mostly for little younger patients. So if they want a blepharoplasty, we can go with the transconjunctival approach. Otherwise, old people, if you want to remove the skin also, if there are some wrinkles or so many excess baggy eyes, if you want to remove, you can remove skin, means you can go with skin approach.
One last question, just for the sake of completion. Is there any role of fillers or Botox or anything around the eyes which can be done along with these procedures maybe a little later?
Yeah, later if they want more correction, like that sir said, the teardrift improvement they want, again they looks very dull, they want to improve their look, they can go with fillers.
So she's also an expert with fillers, so that's why I asked that question. So you could get some fillers in as a touch-up,
as you said, that minimal correction, millimeter matters.
Absolutely. So hope this video was informational, and we had a nice time with this. Thanks Ananth and Priya.
Thanks
for those putting up all these. And we'll try and come back with another presentation on maybe PCR or something later on. Thank you.
Thank you.